Oh,
Yeah, I don't think that's,
sorry, I was trying to help.
yeah, no problem. I'm usually not hard to hear. In fact, when I had laryngitis one time, my mother said it was the happiest 3 days that she could remember. Yeah. There, I think we're good. So again, thank you very much for attending. So we couldn't do this without our wonderful, supportive clients and vendors that work with us ongoing in resources. And one of those that is so special to us is Vicki Madigan.
Thank you.
And the Madigan Insurance Group. Vicki's going to speak today, as you can see.
On Medicare Made Clear.
On Medicare Made Easier. And go ahead and take a seat. Find someplace comfortable, no problem. Take your time. Vicki is a benefit counselor and also owner of Madigan Insurance Group. And we are fortunate enough to be able to refer many of our clients to her, and Vicki in turn refers her clients back to us. So that's how we work resource-wise to bring you all the information that's necessary. Vicki is a wealth of information, to say the very least, and really is so wonderful to help you as we're going towards questions on Medicare, also open enrollment, all the things that are coming up. So Vicki, thank you so much. And thank you for your support of Elderwerks. And we know that today you're a special sponsor for us, and we appreciate that so much. So I will turn it over to Vicki.
Hi, good morning. All of you need to have a purple bag. The handouts for my presentation and some other Medicare information is inside a purple bag, and there's purple bags on each table. I want to thank Elderwerks for this opportunity to be their sponsor this year. We do have a booth in the exhibit hall. We are booth 100. We have licensed agents that can answer questions about Medicare for you. If once you make your long walk to the other side of the Tri-Fund Center, you'll be able to meet with people in our booth after the seminar this morning. So this is our address. We have a brick and mortar office in Huntley. We learned technology during the whole pandemic because we could not meet with you face to face. So we can now do Medicare consultations, seminars, enrollments with you over the phone. You're going to need to have a computer or a smart device. I know that might require getting a family member to help you, but I just want you to know that that is available to you. The information on the screen as far as our address is also in your bag. Okay, so I've been hearing as I was getting ready this morning that Medicare is confusing and it's not clear, and why do they make it so hard? So my job today is to make Medicare clear for you. We're going to learn the basics of Medicare, and the key word here is Part A, B, C, and D. You will see in the slide presentation more alphabetical letters, A to N. The key word before them is not part, it's plan. And that's where a lot of people get confused. I do have a couple chairs up here, and I don't bite if you want to sit up here. And I promise I won't put you on the spot. Okay, so we're going to understand your Medicare choices. Here's our agenda. What is Medicare? Who is eligible for Medicare? What are your coverage options? When can I enroll? Because enrollment periods are very important. What are my next steps? And you find more information at our booth 100 or by calling our office. Okay, who is eligible for Medicare? You need to be a U.S. citizen or a legal resident. I get phone calls all the time where people say, I brought my loved one from wherever they came from, and they want them to get Medicare. But they can't because the person is not a legal resident. And they have to have their legal residency for 5 years. Now, everybody thinks you only get Medicare at age 65. People under age 65 can get Medicare if they are disabled. And then any person of any age who's a U.S. citizen or a legal resident, if you have a diagnosis of end-stage kidney disease or ALS. All right, here are the parts of Medicare. Again, I'm going to really emphasize the word part and plan, because if you can understand that concept, then it won't confuse you as much. So Medicare has 4 parts, A, B, C, and D, and then secondary coverage called a Medicare supplement. All right, if you go by our booth today, we have an oversized poster of this chart, because this is the roadmap to getting your Medicare secondary coverage. So the goal is that red, white, and blue card in that upper left corner is, is your original Medicare card. That card is nothing more than catastrophic coverage. So 26% of all Americans carry red, white, and blue card, no secondary coverage. You are at huge financial risk. So once you have your red, white, and blue card, which is the key to getting into Medicare, we have people like wait till like 3 days before they turn 65, call our office or walk in and say, sign me up for an insurance plan. And we can't, because if you do not have a red, white, and blue Medicare card, you cannot get on either of these roads. And one of the things I want you to keep in mind about these 2 roads is they both get you to the same point. Think about driving here today. We all got here, but we maybe came westbound on Higgins or eastbound on Higgins, but we got here. So the goal is to protect you from out-of-pocket expenses and financial ruin. And we can do that 2 ways. All right, so I teach school, so I have to put vocabulary and definitions in every slide presentation I do, okay? So a lot of people get confused with insurance language. So the first thing is called a premium. You're used to paying premiums. You pay them for homeowners insurance, life insurance, car insurance. So a premium is the amount you pay to own your plan. A deductible is also the amount you pay before your insurance pays anything. Now, where people get really confused is in copay and in coinsurance. So maybe you've gotten an explanation of benefits after having a medical procedure, and someplace it says you have a copay of, or you have a coinsurance of. All right, so copay is always going to be a dollar amount, like $10 or $20. And for the contract, that calendar contract, January 1 to December 31, your plan, we'll call it Plan X, is going to have a $20 copay. That's not going to change for the whole year. Now, coinsurance is a percentage. So if your doctor charges you $100 and you have a 20% coinsurance, you're going to owe 20%. All right, we're going to talk a little bit about the Part B premium. Let me just see by a show of hands, how many people are already getting some kind of monetary benefit from Social Security? You get money every month, you get a check. Okay, most of you don't know that they're taking money out of that check before they send it to you. You might get a statement at the end of the year, but you know that you get your $1,200 every month. I do have some chairs up front. You get your $1,200 every month, but maybe you're really getting $1,300 or $1,400, but you don't see the rest because of the Part B premium. Now let's talk about the Part B premium. If you're if you're like me, I'm not taking Social Security benefits yet, and I have Medicare Part B, I write Social Security a check every month. If you're already getting a Social Security check, retirement check, then they're going to take that money out of your check prior to the direct deposit. So kind of like when you were working and they took out your taxes, you know, you're not missing it because you're used to getting the same amount. So let's talk about how much does that cost. The standard Part B premium for the year 2022 is $170.10. All right, so you'll get a letter sometime November, December, end of November, beginning of December. That's going to come from the Social Security Administration, and it's going to say, with your name, your Part B premium for 2023 is. And I can't give you a dollar amount on that because I don't know your income. So then we have this down here at the bottom, IRMAA. I call it IRMA, but that's the acronym. It stands for adjusted. It's an amount of money that they can adjust based on your income. So income related monthly allowable adjustment. And that what's happening is Social Security and Medicare are talking about your tax return from 2 years ago. So I don't see your tax returns. I'm not an account, I don't do your taxes, so I don't see those. Now, let's talk about what is income. Social Security money, taking money out of an IRA, an annuity, a royalty, an inheritance. Those are all income related things. And if you go over a certain threshold, then this Part B premium increases from 170.10. All right.
Can we go back a minute? What is MAGS?
Modified adjusted gross income. It's not, what line is it on your tax return?
Pardon me?
What line is the modified adjusted?
There's no line number. Your modified just takes into account certain
Yeah.
other things.
So like when you do your taxes, help me if I'm wrong here, and all your deductions come off, that's the number you're left with?
It's your income. No, it's not all your deductions.
No.
That's your taxable income.
Okay.
Your
This is my tax expert, by the way.
Your adjusted gross income is going to be all your income minus any possible adjustments, which in situations that are in this room, more than likely it's really just all of your income totally that you're taxed on, because your Social Security is only taxed up to 85%.
All right, so you need a tax person, come see Kim. Anyway, okay, so let's go back to the Medicare card. Your red, white, and blue card says Hospital Part A. If you look at your red, white, and blue Medicare card, so when you're a Medicare beneficiary and you use health care, you have something called a status. So this, if you're writing notes, this is one thing I want you to write down. You have a status when you use health care. Medicare Part A status equals admitted. So let's just do the thing. Part A is a letter A. Admitted is a letter A. If you're using Part A of Medicare, you're admitted. You have an admitted status to the hospital. What kind of services are you getting? A doctor wrote an order, you're admitted to a hospital. You're admitted to an inpatient behavioral health unit. You go to an inpatient skilled nursing rehab. You're on hospice. Now the hospice, you can be home or you can be in a facility, and you're getting a blood transfusion. This is the only 5 things that Medicare Part A covers. Medicare Part B, let's put a word with the B. Bye means you go home. Okay? You go to your doctors, you go bye, you go home. You go to the St. Alexis and get a blood test, you go home. Even though an ambulance takes you to a hospital, it's considered outpatient services because you don't stay in the hospital. I mean, in the ambulance, excuse me. If you go see an outpatient mental health provider, get a lab, purchase some durable medical equipment, go for occupational therapy, physical therapy, cardiac rehab, and then Medicare gives you, you might not know this, 23 no-cost services called preventative care. Now, in red letters, I have the word emergency room. Where do we find emergency rooms? In a hospital. So our common sense thinking says that ambulance took me to an emergency room in a hospital. So the hospital part of Medicare should pay my bill. Wrong answer. It's Medicare Part B. Okay? Now, remember I was telling you about that status? Medicare Part B status is outpatient. So quick review. Medicare A is inpatient. Medicare B is outpatient. Okay? And then we have observation. So when you're on Medicare oops, my screen is moving here. When you're on Medicare Part B, you need to know your status. And especially if you're in observation. Because if you don't follow the rules in observation, you as consumers get stuck with the whole bill. Did you hear what I said? If you don't know your status and you don't follow the rules with observation, okay, then you're going to end up with the bill. Okay, so we worked all our lives to get Medicare, and we get this original red, white, and blue Medicare card, which I've told you now is catastrophic coverage. And they're like, well, you can carry this card, but we're not going to pay the deductibles, and we're not going to pay the co-insurance, and we're not going to pay the premium. And if you have an excess charge, which is the difference between what the medical provider bills, what Medicare approves, we're going to charge some of those costs back to you. Medicare Red, White, and Blue Original Medicare does not cover prescription drugs. Oh, and by the way, no hearing, no vision, and no dental. And if you get in a long-term care situation or custodial care situation, we don't cover you at all. So let me explain what that last bullet point means. Long-term care or custodial care is, let's say you're the person who has a stroke. So you go to a hospital to get the medical care, what they call acute care, for your stroke. Now you're recovering and you need to go to a rehab facility. And you're there 5 or 10 days. Hello. You're there 5 or 10 days and you're not making any progress. So when you go to a rehab facility or you go into a skilled nursing facility, they have an agenda. They want you to meet certain goals. And as long as you meet those certain goals, Medicare pays for your stay. But if you're not meeting those care goals, they change your status to custodial care, which is where if you purchased long-term care insurance, now you're going to use that insurance, or unfortunately, it becomes self-pay. Okay, your original Medicare card, if you don't have secondary coverage, passes on some pretty big deductibles in the Medicare Part A. You get $1,556 of a deductible for this year, 2022. But guess what? Every 60 days, it renews. Okay, so if you're in the hospital, mathematically, every 60 days, then you could have up to $9,000 in deductibles. This is why you need secondary coverage. The Medicare Part B deductible for this year is $233. Now, you're probably going to get the answer right. Is this going to go up next year? Yes, it's going to go up next year, and so will your Part B premium. The biggest thing here is what's in red. We call this MOOP, M-O-O-P, maximum out-of-pocket expenses. Means there's a ceiling. Okay, so when you were working or when you were on the Affordable Care Act before coming into Medicare, your insurance policy had a cap or a ceiling. It said, if you spent $5,000 in a calendar year, at $5,001, we will now pay 100% of your claims. Now remember, I'm talking about the original Medicare card. Has no ceiling, has a big deductible in Part A, and also that there's that co-insurance I talked to you about at the beginning. Both A and B have 20% co-insurance. This is out of the Medicare and You book. Medicare's website is medicare.gov, and if you go there, you can download Medicare and You, but most of the time, Social Security or Medicare mails you a new book at the beginning of the annual enrollment period. All right, so there's that left lane. We're at the bottom so far. I've already talked to you about Medicare. Look in the top of the chart, Part A and Part B. And I just told you that you're going to have a lot of out-of-pocket expenses if you don't have a secondary coverage. So now I'm going to talk to you about standardized Medicare supplement insurance plans. All right, so what are they? They came into being in 1965. They were brought to us by Lyndon Johnson during his presidency. There is no other insurance you've ever been on that you can compare this to, nor will there probably be anything in the future. What does Medicare supplement insurance do for you? It helps you cover some of that out-of-pocket expense, like the deductibles and co-insurance and co-payments for Medicare Part A and B. While it is offered by private insurance carriers, it is a federally regulated product. So when I'm meeting with my clients one-on-one, I tell them, as an American, This is the only time brand name does not matter. Because as far as the benefits go, if everybody in this room had a Medicare supplement Plan G, let's say, and we all go over to Alexian Brothers and get our gallbladder out, everybody's bill's getting paid the same amount of money because you're in Illinois and you're on a Plan G. Doesn't matter whose name's on the wrapper. That's how the federal government pays it. Okay, so the plans, you enroll with a private insurance company. There's plenty of them in the hall down there, and our booth is there to help you do that. And then, oh, remember at the beginning I said you're going to see the word plan? Look at the third bullet point. Here's your plans. Here's your alphabetical letters for a second time. So if you notice, we have Part A of Medicare, Part B of Medicare, Plan A of Medicare, Plan B of Medicare, and Lyndon Johnson wasn't really smart when he did this. Okay? Now, the benefits vary by the plan. So like anything else, the more benefits you have, the higher the cost. The higher the cost, okay? So the more comprehensive the coverage, the higher the premium. If any of you are planning to move to Massachusetts, Minnesota, or Wisconsin, I have to do this all over again for you at another time and show you those rules, okay? I will say here, a lot of people, like I live in the Del Webb community in Huntley, and we have a lot of people in our community that own homes in other states, okay? And some of you decided you got a better tax break by becoming, let's say, a Florida or an Arizona resident. But even though you live in Illinois 6 months out of the year, your enrollment goes for the resident of the state where your driver's license is. Okay, so if you move to Florida and you come see me and say, I want to enroll in a Medicare supplement plan, and you give me your driver's license as identifying you, and it's some state other than Illinois, that's the state you get the premium rates for. Prior to 2020, anyone who had a Part B, so let's say your Part B was 12/1/2019. Anybody before that time could enroll in plan letters C, D, and F. So I'm getting ready to turn 65, and I am not eligible for plan letters C, D, or F. They got taken away with the macro law. The other thing the macro law did for you as consumers, you around 2018 or 19 got a new Medicare ID number. You got a new card. It took your social security number off your card as an identifier, and you got something that doesn't make sense, a bunch of alphabetical letters and numbers, and you're like, how did they know it's me? That was to protect your identity. That was part of this macro law. All right, now I know it's really hard to see this chart, but basically I'm just going to teach you how to read it because you can get it online. You can look at it in the Medicare and You book. You can come by our booth and look at it. The left column are all the medical services, like Medicare Part A, B, hospice cover. And then the plan letters are A to N. So you read it like a graph. So let's look at G. G has 100% in everything but the one box. So right now for 2022, G is the most comprehensive plan for those of us turning 65. The only hole is the Medicare Part B deductible. And I see camera, so I'll wait a minute if somebody wants to take other pictures of the chart. So basically what that says, if you have a Plan G, is you go to the hospital and that big $1,566 deductible is paid 100%. So I can go to events, family events, church events, and somebody will say, oh, you do Medicare. My loved one had brain surgery and the bill was $1 million and they didn't pay anything. Well, they didn't pay any medical bills, but they did pay premium to own their policy, and the plan they had paid the deductibles and paid the bill. All right, am I good to go? No more pictures? Okay. So what do you have to do to be eligible to enroll in a Medicare supplement? Starting point, have to have original Medicare, red, white, and blue, A and B card. I already told you you need to be a resident of the state which you apply for. 65 or older or under 65 with certain disabilities, and people at any age with end-stage renal disease. All right, in your bag there, while I take a quick drink of water, I want you to get out the picture that's got the donut on it. All right. If you didn't get a purple bag, it's inside the purple bag. All right. So we've talked about Medicare Part A and B. We've talked about Medicare supplements. And now we're going to talk about Medicare Part D, which are your drug plans. Okay? So there's 2 papers in there. One's got a picture of a donut on it, and one's an annual enrollment folder. Do you have enough bags, Emily?
I think so.
Okay. What does Part D do? It helps with the cost of prescription drugs. The sheets are in the bags. If you don't have a sheet in your bag, we'll just get you a different bag. Okay. All right. So drug plans. This is your prescription drug plan. Fast facts. Prescription drug coverage does vary from plan to plan. In the state of Illinois right now, we have 57 standalone drug plans. Okay, it's supposed to, it will help you protect you from high drug costs with catastrophic coverage. Some of the new things that are coming, there was a new law signed by President Biden by 2025. It's going to reduce the out-of-pocket costs for drugs for seniors or people enrolled in Medicare. What's already in place is a cap on insulin at a $35 copay. Okay, now, when you enroll in a Part D drug plan, there is a list of drugs that that particular plan covers. So I'm just going to call it Company X for right now because I can't talk about actual plans in this seminar. So you have Company X, and it has a list of prescription drugs that it covers. That list is called a formulary. Think of it like a dictionary, alphabetical A to Z, but it only has medications. So if you're currently in Medicare and you currently have a drug plan, your plan has a formulary. So you go to the doctor tomorrow, you get a new drug. You can go look in that formulary and find out what the tier is, which I'm going to show you in a minute. And then you'll be able to have an estimate of what that drug will cost you. Okay. The list of the formulary changes each year. So during the annual enrollment period, we have software at our office where you call us or send us an email, or if you don't have anything electronic, people have written it on a piece of paper and dropped it off. Just make sure your name's on it. And we'll run your medications through a computer program, and we can tell you the cost for all of 2023 and what the best plan is in relationship to your medications. All right, this is a big thing. Turning 65, or I left work and I need drug coverage. Nobody automatically enrolls you in it. And if you don't come into the enrollment at the correct time, you get a penalty. And it's not one time, and it's not once a year. It is every single month till the day you die. Okay? I don't care if you don't take an aspirin, and maybe all you take is vitamins. You need a Medicare drug plan to be compliant and not get penalized if down the road you need prescription drugs. Okay, here's the formulary slide I was telling you about. So kind of like when you go to a new city and you want to try a restaurant and you go to TripAdvisor, if you want to eat at McDonald's, you have a $1 sign. If you want the excellent restaurant, that's got a $5 sign. Great for when you're eating out, not great for when you're buying your prescriptions. So just know the higher the number in the tier, the more money out of your pocket at the pharmacy. All right, this is where I want you to be. Your numbers are going to look a little different. I'll get to your numbers in a minute. This is the current year 2022. So let me give you the numbers for 2022. Your deductible was $480 this year. If you're still turning 65 between now and the end of the year, you will have a Medicare Part D deductible of $480. Your initial coverage stage will be $4,430. Your coverage gap, which is the donut hole, will be $7,050, and then you move to catastrophic coverage stage. So the flyer you have is this one, which is the 2023 numbers. So you can see that the deductible is moving from $480 to $505, In the 12 years I've been doing this, I've never seen it go down. Okay? And I get telephone calls about this time of the year because people go, I went to X pharmacy last month and I paid $50 for my medicine. And now I'm standing here and the pharmacist is telling me it's $250. And what did I do? What did you do to me? Okay. So what I want to explain to you today is the Part D yearly coverage process and how the donut hole works. Anybody in here confused about how the donut hole works? Okay, see a lot of people nodding. So if I can teach you this process, it won't confuse you anymore. It's actually pretty simple. So know at the beginning of a calendar year, this process runs January 1 to December 31. Everybody is subject to that first purple square, yearly deductible. Now, there's some reasons or rules about why some of you don't pay a deductible, but that's specific to your plan. So for what I'm going to show you right now, we're going to assume every one of you have to pay the yearly deductible. So let's just say that's January, February. You go to the pharmacy, you're paying more money for your prescriptions because you're paying more money because you have to pay the deductible. January, February. March comes, you move to initial coverage stage, okay? So what is this? This is a group of entities helping you offset the cost of your medicine. So I don't do math in my head, I have to use round numbers. So let's say the retail cost of your medicine is $1,000. You're not paying $1,000 when you walk up to the desk at the pharmacy. In the first stage there, let's just say you have a $50 copay. You paid all this money in the deductible to review, and now it's March and you pay a $50 copay for that $1,000 medicine. Who pays the other $950? Okay, so if you read this, it says, Medicare sets aside a yearly amount to offset the total retail cost, which we call true out-of-pocket expenses for your medication. So who's paying that $950? The government, the private insurance carrier where you have your plan, okay? And the manufacturer may have a discount on that particular medicine. All right, so if your true cost of your medicine, for easy math, is $1,000, how many times does $1,000 go into 4,660? A little over 4. Okay, so January and February yearly deductible. You got 4 more months. March, April, May, June. Your bank's empty, right? Is everybody following me? Because you've used all the money to offset the cost. Your bank is now empty. What did I just say? It was June. So July, you go get your meds again. Same meds have not changed. And you're right here. And you step up to the counter. And the pharmacist doesn't tell you you owe $50. He says you owe $250. And that's when my phone rings. Okay, how did I do this? Okay, because now you used all your money in stage 1, and now for next year you have to meet $7,400 in true cost. So you're paying 25% of that retail. Okay, so again, $1,000 goes into $7,400 about 7 times. Well, we don't have enough months left in the year, so you're probably going to end here. However, if you got here earlier and you did meet this coverage gap dollar amount, you move to the last stage, which is catastrophic, where you're paying next year 5% of the retail cost, or $10.35 for a brand name, or $4.15 for generic. This is a process. It goes the same every year. It has never changed. What has changed are the numbers, but the process is the same. So, what causes you to go to the donut hole is your medication. I want you to think about TV. Do you ever see a commercial for penicillin? No. Penicillin's tier 1 or tier 2 drug. But you see Ozempic and Eliquis and Xarelto and anything that's got a jingle. When people sit with me, I'm like, does your medicine have a commercial? Okay? Because if your medicine has a commercial, guess where you're headed? Okay? So if you take a drug, I can't think of the name of it now, like Crestor, which is a brand name, or Plavix, which is a brand name, and now they have generics. They were here, but now they're back in tier 1s because they have generics for it. Now, please don't think I'm telling you to go get off your medicine. I am not. But I'm saying if you have a condition that requires you to have that tier 3, 4, or 5 medication, there is no way to avoid the donut hole. Does not matter if you're insured by company H or B or A or whatever company you're enrolled in. It's the money process here for the true out-of-pocket cost and the deductible. So if you have questions about this, go ahead and write them down. I'll answer them at the end. I cannot, because we're in a group setting, I'm bound by HIPAA laws and regulation and Medicare compliance. So if you want me to talk to you about your particular medications, our appointments are no cost. You need to make an appointment. All right. So this is a very small example. Yes? Can you hold it to the end for me, please? Because they're taping. Can you just hold your question to the end? Thanks. So Medicare Part D has a penalty. This is a small one. They take a number of dollars and cents and multiply it by so many months, and then they add that penalty to your premium. But let me give you a true example. The Part D program started in 2006. So if you're in your 80s, you might have like 127 months of no Medicare Part D, times right now it's 34 cents. So this is a true story. I had a customer who is now no longer with us. Very healthy woman, never took meds, said, I'm not buying a drug plan. At her end of life, got very sick, ended up in a facility which are going to require you to have a drug plan. She had an $89 a month penalty on a $20 a month premium. Okay? Please get a Medicare Part D program. The sooner, if you've got a penalty, the sooner you get one, it stops. All right, Part C. Look at the circle. We have a bed and a stethoscope. So you have Medicare Part A, Medicare Part B, rolled into one ID card called Medicare Part C. All right. What are Medicare Part C plans? This is the second column. Remember, way back at the beginning of this, you had two columns. The left column, original Medicare, Part D standalone drug plan, Medicare supplements. That's one option to cover your out-of-pocket expenses. The or the other option is a Medicare Advantage plan, which combine your Medicare Part A and B, and in many cases can include prescription drug coverage. Once again, offered by private insurance carriers. This is what you're seeing on your commercials, okay? The stuff that runs ad nauseum, Joe and the other guy, JJ Walker, okay? They're always talking to you about Medicare Advantage plans. Very much, there's the dental, the vision, the hearing care, the wellness service, and the nurse phone line. They give you benefits that original Medicare doesn't. If you look in the Medicare.gov booklet, Medicare and You, it will tell you by definition that a Medicare Advantage plan must offer you all the same benefits as original Medicare and more. Now that varies by plan, that varies by where you live, okay? You must be enrolled in Medicare Part A and B. You must live in a planned service area, and Medicare Advantage plans are not affected by any underwriting or health status. So people say, what is a planned service area? It means, where do you live? I think I'm in Cook County right now. I live in McHenry County. My office is in Kane County. So if I was writing somebody today here or enrolling them in a Medicare Part C, the plan I would be showing them or enrolling them in would have to offer coverage for Cook County. So plan service area refers to the county in which you live. Okay, what is the cost? Again, it varies from plan to plan, and it can change from year to year. And everybody, whether you're in a Medicare supplement or a Medicare Advantage plan, must pay that $170.10 or your rate for the Medicare Part B premium. Instead of having 3 ID cards like the left lane, remember the left lane has your original Medicare card, your Part D standalone card, and your Medicare supplement card. The right lane that we're talking about now, Medicare Advantage, has 1 ID card. Many of them include prescription drug. The plans that don't, there's special circumstances, which we would talk about individually. The next 2 are talking about the network and coverage limited to a service area. That's not on all plans, that's only on some plans. And like I said, some plans offer you additional benefits like dental, vision, hearing. Okay, so let's talk about the types of Part C plans. HMOs. What's an HMO? Health Maintenance Organization. It has a network. In order for your bill to be paid, you need to use an in-network physician. If you go to your primary care doctor and you tell him, I need an orthopedic, he has to write you a referral. So I call HMOs Mother May I. Okay, because you go to your doctor and you say, can I please go see doctor over here? And they write you a referral. Yes, if you go to Disneyland in fall, there's emergency coverage because you live in Illinois. All of these plans have in-network emergency coverage, okay? But HMO, you have to get the referral or your bill does not get paid. Preferred Provider Organizations, PPO. Those have in-network and out-of-network. What does that mean? It means you can call up a doctor that's in that network on your own and book your appointment and go. If they're in network, you pay less money. If you're out of network, your bill probably still gets paid, but you pay more. Special needs plans. Special needs plans can come and benefit you if you're financially struggling. There's what they call DSNPs, which for people who are on Medicare, Medicaid. And then there's special needs plans if you have a chronic or debilitating illness like diabetes, COPD, coronary artery disease, congestive heart failure, or all kinds of special needs plans. Okay, and then you have health maintenance organizations, HMOs, that have what I call like a soft-sided suitcase. They expand a little bit. So here's an example of where an HMO point of service plan would work. You go get your gallbladder out, and your surgeon is in your network, but they consulted and hired in a contractor to give you anesthesia, and you're asleep, so you can't check if that guy's in your network or not. And then you get this bill. So a point of service plan with some of those types of, that also happens with laboratories. Your doctor draws your blood in his office, they're in network, your blood goes someplace else, you didn't have any say about it, and then you're out of network. All right, this is super important. I used to jump rope as a kid, I don't anymore, but jumping in or enrolling at the right time is super important. In your bag, you have like this big star. Let's see, I can hold one up. Oh, the humidity, they're sticking together. Let me give you that back. So you have this flyer, okay? These dates never change. I don't care what year it is. Your annual enrollment, AEP, is from October 15th to December 7th every single year. If you have a paper calendar, you write it on it right now. Okay, all of you, if you're Medicare eligible, can enroll for a new plan. Your new plan then starts January 1. Okay? We have our database of clients get a poster that talks about, in the mail, a postcard. It talks about that. We want you to call us and say, I like my plan. I'm not doing anything new. Then you're just going to roll into January 1. Or you would call and say, I got 3 new medicines. We're like, okay, we need your med list. We need to check that they're on the formulary. We'll call you back. if you're good to stay where you are, we'll tell you. If we're going to save, last year I saved one person $6,000 by changing their drug plan. If they would have stayed where they were, they would have had a very big expense. So that's everybody. Everybody in Medicare is subject to annual enrollment period. So I'm going to ask for your help. Like every other business, I'm short-staffed. I usually call you back within 4 hours. During AEP, it might be the next day. Be nice to my staff because they're working really long hours. Medicare gives us 7 weeks to see the millions of Medicare beneficiaries out there. So we work a lot of hours. I tell everybody it's my tax season. Okay, this is me right now. IEP, my birthday's December. So starting tomorrow, September, October, November, I can apply for Medicare 3 months before my 65th birthday or 3 months after. This initial enrollment period gives the Medicare beneficiary some extra bonus benefits like no health questions asked, nobody's looking at your meds, every insurance carrier will take you, no questions asked. It's a chance to jump in and get the lowest premiums on things like supplements. And number 3, special election periods. They just came out with a new one. If you could not enroll because you had monkeypox, now you have a special election period. Okay, usually special enrollment periods are things like some of you might still be working. You might be 66, 67, 68. You're working. You have a 40-year-old wife, so you had to stay on your employer group health plan. Now it's time to come into Medicare because you're retiring. That's a special election period. You do not get any of the penalties. The penalties happen when you don't have something called creditable drug coverage. Okay, so right now I'm working. I have an employer group health plan at my agency. When I leave that to go to Medicare, no gap in coverage, no penalty. That's what comes in your mail. You can't miss it, okay? If you do, it's like 9 inches by 11 inches. It's really big. It's not going to get caught up in your newspaper or whatever. And notice, we're going to give you a checkup at no cost. You can come to our office or we can talk to you on the phone. All right, what are your next steps? Do I have anybody in the room getting ready to turn 65 or getting ready to apply for Medicare Part B? Okay, write down this website because Medicare starts at the Social Security office. Okay, there's a Social Security person in the exhibit hall. Medicare doesn't start at Medicare. Medicare starts at the Social Security office. And I know I'm going to get this question. No, you don't have to sign up for your retirement money. So you can sign up for the health plan and not sign up for your retirement money. Okay. There's our information, my email, and my website. If you go to the website, there's a short video about all this. Again, if you need a review, there's our infomercial that we did for the Elderwerks Better Aging Expo. I have other licensed agents in my office that can also assist you. There's nobody there today, though. They're all here. So just like wait till tomorrow or tonight to call. And now I would be glad to take questions. And I'm going to move. Go ahead.
See, I have a Medicare supplement.
You have a Medicare supplement. I'm just repeating so they can hear.
Yeah, and I switched to a Medicare Advantage plan.
Okay, so you went from a Medicare supplement to a Medicare Advantage.
Yeah, this is that open enrollment.
Last year at annual enrollment.
And then, after a few months, I decided I don't like it and I want to go back to the Medicare supplement plan.
Okay.
What's involved? I mean, do I get
How long have you been on the Medicare Advantage plan? Did you get on it in January?
I get on January 1.
Okay.
And by say about November, I decided I don't like it.
Last year, November, you decided you didn't like it. Okay, so during the annual enrollment period, you could talk, whatever agent you work with can give you a Medicare, re-enroll you in a Medicare supplement and a standalone drug plan. Now, I'm going to assume to answer your question, I'm just assuming that the Medicare Advantage plan you have has prescription drug coverage with it? Okay, so when you it's called disenrollment. When you disenroll from your Medicare Advantage plan and return to original Medicare, purchase a Medicare supplement, you also need to purchase a standalone drug plan.
I did all that.
You did all that already.
All right, so now after several months have gone by after I did that, and now I decide I don't like the Medicare Advantage plan, and I want to go back to the Medicare supplement.
Okay, so the open enrollment is coming in October.
Okay, so would I be underwritten?
Yes.
So if I go back after underwritten this, like getting.
Have you had the Medicare Advantage plan for more than 1 year?
If I've had it for less than 1 year, then I'm not underwritten.
So there's a rule called the trial period on Medicare Advantage. I don't know who your Medicare supplement, whatever Medicare supplement company you left to go to Medicare Advantage, in the trial period, if you're truly in the trial period, that Medicare supplement company will allow you to go back to the plan that you were enrolled in. Of course, your premium cost is going to be higher.
Because then they're going to look at.
Nope, not in the first year. So here's a general answer for everyone. If you want to leave Medicare Advantage to go back to a Medicare supplement, you can do that. If it's more than 1 year, you have to pass through underwriting. Okay, and somebody else, this lady over here. I can't hear you, I'm sorry. Okay.
Vicki, I had a couple of questions online. People were asking how to see the documents that we were able to share in the room.
If they can call my office, we can PDF them, or you can come in for an appointment and get them.
And there was another question about what kind of plans that your agency provides.
Okay, our agency is a full agent broker agency. We offer all Medicare products, Medicare Advantage, Medicare Supplement, and Medicare drug plans. We have many, many contracts. We can write all major carriers. And we also have dental, vision, hearing plans, hospital indemnity plans, life insurance, what? There's always one. Okay, yes, ma'am. There is no fee to come to our office for a consultation. Just your time. Yes, ma'am.
After the initial free consultation, is there any fees to have you?
I like Starbucks.
Hey, I can handle Starbucks.
No, okay, so she asked if there's any fees. Not legal, just so you know this in the future, not legal. I will not take your money because it's not legal for me as a licensed agent to take a fee to assist you with Medicare. But I will take a Starbucks.
Thank you.
So when you sign up initially, do you have to sign up for D also
Yes,
to not get the penalty?
yes.
Now, do you have to do that if you're still working and still have insurance?
That would be, I don't know what your insurance is. Come for an appointment, give me an hour of your time. I can let you know that, sir.
You said Medicare Advantage, you're still paying the $170.
Correct. Okay, I heard you ask me, do you pay the 170.10? Yes, and then I did not hear the rest.
Is there an additional fee on top of it? Like what is Medicare?
Okay, so there could possibly be a premium. And the premiums range depending on the plan.
Okay, but it's more than likely going to be more than the 170.
No. I can't talk about plans here or dollar amounts, but we can meet with you one-on-one and be able to help you.
Got one more question. So I'm a veteran president who came around. If I have a surviving spouse that has a CHANT VA benefit, is Medicare, basic Medicare more advantageous because technically she has a supplement then versus doing Medicare Advantage?
So I'm going to tell you what I've seen. I don't get a lot of CHAMP VA clients. I have some clients that have their Medicare Part B and their CHAMP VA. Excuse me. And then I have CHAMP VA clients that have Medicare Part B, CHAMP VA, and their own Medicare supplement or Advantage plan. It just depends on the individual. Thank you, ma'am. there is a deductible every 60 days on Medicare Part A if you're only on original Medicare. If you have a Medicare supplement or a Medicare Advantage plan, that absorbs that deductible for you. Okay, she's asking me if you purchase dental insurance, is there a waiting period? It depends upon, some policies yes, some policies no. Depends on the carrier you purchase it from. Are we good? Thank you all very much. Have a great day.
Thank you so much.
Oh, man.
As you may already know, Elderwerks is a not-for-profit organization supporting any older adult or senior who has aging questions, needs referrals for assisted living, memory care, home care agencies, or other senior housing options. Our complimentary services are always available to you. Just give us a call at 855-462-0100 or visit our website, elderwerks.org, elderwerks.org, where you'll find hundreds and hundreds of articles and supportive material to help you through the aging process. Again, thank you for taking aging seriously and planning for your future needs. Enjoy Elderwerks Expo.
Hi, everyone. It's Carol Razzo. I'm Senior Strategy Director at Elderwerks, and today we're very fortunate to have our platinum sponsor, Vicki Madigan of Madigan Insurance Group. She is agent, broker, and owner. And Vicki, if you would share your expertise with us today, what is a key point or something very important that you think seniors and their families should know approaching enrollment coming this October?
Well, thank you for having me. And regarding the annual open enrollment period, that is every year. It never changes. The dates don't change. They're October 15th to December 7th. And all Medicare eligible beneficiaries, either if you're coming into Medicare for the first time, need to meet with an agent to find the most appropriate plans for you. If you're currently enrolled in Medicare plans, this is the one time a year opportunity that those Medicare beneficiaries get to review their Medicare supplement, their Medicare drug plan, or their Medicare Advantage plan. So it'd be very important for them to meet with an existing agent. If they don't have an existing agent, then they're welcome to call our agency at Madigan Insurance Group in Huntley, and we would be glad to help them, or we can meet with them at the senior fair as well.
Thank you very much, Vicki, and we are looking forward to everyone enjoying the senior fair and for you to hear Vicki's presentation in addition to visiting their booth. Have a great day.
Everybody, I'm Gail Nixick with Elderwerks. I'm the Vice President. I'm here today with Kerry Peck, the Managing Partner of Peck Ritchie, who's kind enough to join us and be a gold sponsor of the Elderwerks Aging Better Expo. I would like you to meet Mr. Peck, and Kerry, if you can just give us a brief, something to share with individuals when they're thinking about planning for an older adult, what is important for them so they can avoid a crisis.
Well, Gail, thanks for inviting us. As you know, I'm going to talk about celebrity estate battles
at the upcoming event. But I think that what people forget is whether you're a celebrity or whether you're not, everybody needs to do advanced planning. And the reason they need to do advanced planning is because you don't know when you're going to get hit by a bus. You don't know when you're going to have a stroke. You don't know when you're going to fall and break a leg and be unable to get off the ground. And the reality here is the most important thing you can do for yourself and your family is plan in advance. Here in Illinois, we have two types of durable powers of attorney. On my one hand, it's a durable power of attorney for property, which is management of assets. On the other hand, it's a durable power of attorney for health care, which is management of clearly healthcare decisions, what doctors you're going to, where you're going to live, who's going to perform surgery upon you, when you're not capable of making these decisions. And none of us ever believe that we're not going to be capable. All of us believe that all the way until the end, whenever that is, whatever end that is, we're going to be in charge and maintain our own mental faculties. The reality, ladies and gentlemen, is we aren't. Statistics show we aren't. So planning for lifetime planning is just as important as planning a will or a revocable living trust for post-death planning. So at the end of the day, what's the takeaway? The takeaway is do advanced planning. We are all mortal. We like to think we're immortal. We like not to face our own mortality, but it's important that we do because our families will thank us for it later. Thanks so much, Gail.
You're very welcome, and thank you. That is such excellent advice. We hear it all the time, and we know that this happens. You know, if they could avoid this, if they would just do planning. So I invite everybody to join and watch Kerry as he presents at Legal Planning Celebrity Estate Battles at 10:30 to 11:30. And thank you again for joining us and being one of the gold sponsors, Kerry.
Our pleasure. It's a great organization to work with. Take care.
We appreciate that. Thanks again.
Bye-bye.
Bye.
Hi, I'd like to introduce Sylvia Spiegel, Senior Sales Manager with Humana. And welcome and thank you for being a Platinum sponsor for our expo today. Sylvia, why would a client choose Humana for insurance and Medicare needs?
Yeah, thank you. So really happy to be here and join you. We understand that health needs are very important, and the health needs also sometimes go on beyond Medicare needs. So what we mean by that is that we are here to guide our Medicare beneficiaries through their health plans, and also adding an extra touch of what we call human care. So we want to make sure that we address social detriments, provide the right plan benefits for them, and just help guiding them and helping them take a proactive approach in their own healthcare needs.
Thank you.
You're welcome.
I'd like to introduce Anna Sampley from the Alzheimer's Association, one of our silver sponsors today. And the question that I have for the Alzheimer's Association and Anna is, why is the Alzheimer's Association the best resource for a family member looking for answers to start to help a loved one?
Hi, Barb. Thanks so much for having us. The Alzheimer's Association is the leading volunteer health organization in Alzheimer's care, support, and research. We work to provide care and support for all those affected by Alzheimer's and other forms of dementia. Our free nationwide 24/7 helpline, which is 800-272-3900, is staffed by master's level clinicians and specialists, providing confidential support and information to all those affected in over 200 languages. We also conduct face-to-face and virtual caregiver support groups and early stage groups, as well as education programs in communities nationwide, and we work to ensure that those services reach underserved population. We also have an online community forum, ALS Connected, which provides a place for people with Alzheimer's disease and their care partners to connect with others, share questions, find answers, and share opinions with individuals or groups in the Alzheimer's community. We provide caregivers and families with comprehensive online resources and information through our Alzheimer's and Dementia Caregiving section located at alz.org, which features sections on early stage, middle stage, and late stage caregiving. We make it easy for families to find programs and services also using the Alzheimer's Association and AARP Community Resource Finder, which is a comprehensive database on dementia and aging related resources. So essentially, we provide care and support, we educate and raise awareness, we accelerate research, and we advocate. We invite you and all those to join our cause. Visit alz.org to find your local walk to End Alzheimer's, which is the world's largest fundraiser for Alzheimer's care support and research.
Thank you so much.
Hi, I'm Carol Razzo, Senior Strategy Director at Elderwerks, and we're delighted today to have a brief conversation with Mike Iwaniki. Mike is with the Veterans Assistance Commission out of McHenry County and a silver sponsor for today's event and a wonderful supporter of Elderwerks for our veterans, seniors, and their families. Mike, your expertise, can you share with us a key tip that you think would be valuable to the veterans and their families that are with us today?
Absolutely, Carol. Thanks for asking. I think the most important thing to consider is if you or a loved one who's a veteran has a need, just simply ask. One of the key things we need to be looking at right now is asking the right person, and the right person is going to be an accredited veteran service officer. An accredited veteran service officer is someone who's gone through the training and is authorized and certified to represent a veteran and their claim and their needs before the U.S. Department of Veterans Affairs. And it is so important to get someone who's accredited. There are so many people. You can go online and you can who claim to be experts, and I'm sorry, many of them are giving very bad advice. I'm regulated by the VA. My counterparts in other VACs have their VA accredited as well. It's really important to reach out to them and they can help. As for asking, each county VAC is a little unique. At ours, we have something called Caregiver Relief Veterans Assistance. So if you are caring for a veteran, or you're caring for the surviving spouse of a veteran, or maybe even both, and you live in McHenry County, we may be able to help you out with some assistance where you can get help so you can get a break. So the caregiver can go out and get themselves a cup of coffee, get their hair done, go visit with friends, and do those things that are so important to keep you in good shape.
Thank you, Mike. Very good point. And definitely on the caregiver side, taking care of yourself is extremely important. But I think you've really expanded on there are resources, and you have to take advantage of those resources and know that you're going to the authorized and the most appropriate people. So Mike, thank you very much. And thank you to the VAC for supporting us today. And I know we're all going to be enjoying your presentation. Have a fabulous day.
Thank you.
I'd like to say hello to Erica Moore, silver sponsor from Assured Home Healthcare.
Hi.
And hi. And the question for you is, how do your caregivers help keep Assured Home Healthcare clients engaged?
Well, we have like private duty services. We have a nurse that comes out and we do a detailed care plan. So then it fits the client's needs. We offer 4-hour shifts, 8-hour shifts, or even 12-hour shifts to just have that companionship with the client and more support. We do the ADLs, appointment runs. If they need any social activities, we can do that. I said errands too, we do, and just engaging at the home, they're able to be at home free. So we just take pride in that and letting them be able to do their activities at home.
That's really, really nice. Thank you very much for your time.
You're welcome. Thank
Talk
you.
to you again.
Hello, everybody. I'm Gail Nixick with Elderwerks. I'm the Vice President, and I'm here today with Sahava Miller, the Home Care Liaison with the Key, a silver sponsor for the Elderwerks Aging Better Expo on August 31st. And we're so delighted to have you, Sahava, today with us. And one of the things I was wondering if you could share with everyone is, what do you see as the benefits of people reaching out to a caregiving agency as opposed to hiring maybe a family member or an acquaintance or someone they might know? How do you see it as a benefit to them when they reach out?
Yeah, no, thank you for having me today. And one of the benefits is being able to have a replacement. If you have a caregiver that is a family member or a friend and they're not able to come, it's much harder to find someone that can fill in and provide care when you really need it. When you work with a company, you can call and talk to a staffing manager, a client care manager, and they will help to find a replacement for you right away, especially somebody who needs care ongoing. They don't want to be without a caregiver. It's important to know that they have somebody coming in there. And also, if there's any, concerns you can reach out to the company that you're working with to help, get you through those concerns. Or if you need to find a different caregiver, you're able to find somebody else. So those are really the big differences and importance of going through, working with the company. And with the company too, that the person is bonded and insured, and that they check the background and confirm that the person has that experience and is available to work.
Great. And my understanding is that, all the caregivers have worked for an agency for a sufficient amount of time. So it's not just hiring someone new to the industry and helping older and disabled adults, correct?
Correct. They all have to have a certain amount of years of experience. And then they also, I think with any company that they work with, they go through training. We specifically have, for example, a whole day of training on different topics such as dementia and Alzheimer's. So they really have to go through continuous training as well to make sure that they're qualified and able to work with the clients.
Oh, that's very helpful to know. Well, thank you for sharing that. And we invite everyone to meet Sahava and the rest of the representatives from the Key at the Aging Better Expo on August 31st, and we look forward to seeing you there. Thank you so much.
Thank you. Looking forward to it as well.
Hi, I'm Carol Razow, Senior Strategy Director at Elderwerks, and I have Sue Grossinger, who is Senior Service Coordinator at Advocate Good Shepherd Hospital and a silver sponsor with us today. Sue, could you share with us a key point as we age that you think would be beneficial to seniors and families?
Sure. Actually, I kind of have two key points. I'll try to make it brief. My first key point I want everybody to realize, and this is a perfect environment to talk about this, is there are people out there to help you. There are tons of resources, and that's why this Elderwerks Fair is so beneficial is because you can really see how many organizations, agencies, lots of different providers in the senior network, the aging network, that are there. So don't ever feel like there is not somebody or something out there to help you, because there is, and you just keep digging. And when fairs like this go on, if you don't need it now, you may need it in the future. So always hang on to that information. My second point is, which kind of ties into this, don't wait until you're in a crisis. And that's why I say, take this information, hold on to it, have conversations with your spouse, with your family, so that when something does happen, your family knows, what your wishes, what you want, what you may need, so that you're not having to deal with things in a crisis is very, very difficult. And you don't always get the choices that you want. You're not always able to make the choices that you think are best for you. So it's really important, plan ahead, make decisions, have conversations with people, save all this information about all these resources that are available to you in the Aging Network, so you're one step ahead if something should happen.
Sue, thank you so much. And those are very important things to keep in mind. And I hope everyone will benefit from it today at the fair. And thank you very much to Advocate Good Shepherd Hospital for being a silver sponsor.
You're very welcome. We're glad to be a part.
Without proper estate planning, family members pay the price. Oftentimes, the result is an expensive probate court battle to obtain guardianship, and eventually, the settling of an estate after a loved one's passing. From those with modest means to the very wealthy, this happens to families on a daily basis. Peck Ritchie is here to help. We can serve and guide your family both in and out of the courtroom so you can find peace at home.
So I'm here with Heidi from Paxum. Heidi, thank you so much, and thank Paxum for being a silver sponsor for the Better Aging Expo here with Elderwerks. Thank you for all you do to support seniors. Could you share a helpful tip for seniors with us today?
Hi, thank you. I think one of the best things you can do is try to start looking into places for moving ahead of time and to start going through that process before it becomes an emergency situation, whether that would be for health concerns or with the passing of a loved one and needing to downsize, and also going through items. And that would be with your kids or passing along things down to your grandkids. Slowly start that process now, so your move can be a little bit more enjoyable as a move can be. But doing that now so that it doesn't turn into an emergency situation where that can become very stressful and overwhelming and really hard.
Thank you, Heidi.
Thank you.
Choosing a Medicare health insurance plan is complicated. Using an agent can help you make sense of the Medicare process. Change your Medicare experience with Madigan Insurance Group. Our licensed staff members provide education to help you understand all of your Medicare choices and make sure that the plan you select is specific to your personal health and financial needs. When it is time to enroll, you can be certain that you have the most accurate information to make an educated enrollment choice. We can secure your same benefits for a lower price by shopping the market for you. To better meet your needs, local agents provide personal service. We can answer all of your Medicare questions. From Medicare, individual health, and other health products, we are here to help. Stop wasting time on guesswork. Come to one of our free Medicare Made Clear seminars to learn how to maximize your benefits and how to avoid penalties that last your lifetime. To get started, call Vicki Madigan for a no-cost needs assessment. Call 847-457-1802 or visit madiganins.com.
Thanks everyone for joining us today, and we're very fortunate to have Brian Edelman, Executive Director at Belmont Village in Buffalo Grove and one of our silver sponsors. Many of our families are fortunate enough to be working with Belmont Village and have loved ones living there at this time, and they are experts in assisted living as well as memory care. So Brian, could you share with us a few points and key thoughts you have regarding what seniors as they age and their families and loved ones should be aware of and really look forward to going forward?
Thank you, Carol. Yeah, and thank you for having me to chat for a few minutes. The first thing I think families ought to consider when they're thinking about senior care and kind of supporting their loved one is really being prepared, and thinking through what is going to happen should something happen to mom or dad or your loved one, whoever that may be. So not waiting for that crisis. We know that things come up and things happen, but really doing your homework and know what the plan is going to be should something happen. So God forbid, a crisis happen in your family, what's the plan? So communities like ours can certainly be a part of that solution of being able to go into place or jump in and help should crisis happen in the family. I think the second thing is really thinking through who that support system is going to be. So it can sometimes be a burden to care for an older loved one. And we've heard many seniors say, I don't want to be a burden to my children. I don't want to give them work to do or to be a hard time. So thinking through, in order to maintain that relationship as simply the daughter or simply the niece or nephew or whomever, how can you take that burden off of your shoulders? And again, communities like ours, home care, different types of companies are available to help provide that kind of support. And really the third thing that comes to my mind is really that engagement. One of the top concerns we hear about seniors in their home is about loneliness and isolation. And it certainly is not a new problem, but the COVID quarantines obviously made it more of a challenge that seniors were really stuck in their home. So how can our seniors get more engaged? And we've found that especially with folks with early onset memory loss, that having that engagement helps to not necessarily prevent, but certainly slow the progression of any cognition or disease process that happens. So finding a place or a community setting where someone can really have that engagement, be around others, both peers, seniors from their own generation, as well as the support staff there to help provide that engagement.
Thank you so much, all of those excellent points. And you're all going to have the opportunity today to visit our vendors. And of course, please be sure to go to the Belmont Village vendor table and they can give you more information. They're excellent engagement programs that they have at their particular locations. And so thank you, Brian, for being with us, and we appreciate you participating today.
My pleasure. Thank you, Carol.
Jeanette from Right at Home is joining us, and I thank Right at Home for being a silver sponsor for the Better Aging Expo here with Elderwerks. Jeanette, could you share with me a couple of thoughts on seniors that want to age at home and what they should be planning for in the future?
Thank you, Dina. Yes, I'd love to share that information. You know, 80% of the population wants to age in place. So the best thing to do is start looking at the home. Look for areas that could use modification in the event there was an ailment. You know, is the bathroom big enough? Is the tub accessible? You know, actually get rid of the tub, really. And, you know, talk about those things with the adult. You know, the adult children need to help with the parents too. You know, and then I guess the best message would be to get rid of the throw rugs. That's the number one safety hazard in homes, and people keep them. So as we age in place, we need to get rid of them.
Thank you, Jeanette.
You're welcome.
A very quiet voice. Who is that got a quiet voice? Who has a quiet voice? Attorney Peck. Okay, Bruce, where do you want me to stand?
The usual spot.
I've never been here before, but if it says usual spot.
To the other side of the screen.
Oh, okay. Oh, that's not.
Stand next to our speaker.
Okay, great. Oh, okay, great. Just tell me when. Oh, good morning, everyone. Thank you so much for coming today. We greatly appreciate it, and we know you're going to enjoy this morning's presentation. I'd like to introduce our speaker this morning. Kerry Peck is the managing partner of the Chicago law firm Peck Ritchie, where he concentrates his practice in trust and estate litigation, estate planning, administration, guardianship, and fiduciary litigation, and elder law. His clients have included families, hospitals, banks, state of Illinois, Cook County, City of Chicago. Kerry is a past president of the 22,000 Lawyers Chicago Bar Association. Kerry has been appointed by the Illinois Supreme Court as chair of the recently created Illinois Supreme Court Commission on Elder Law. If you can tell us a little bit about that later, that'd be great. He was also retained by the City of Chicago Department on Aging to rewrite the State of Illinois Elder Abuse and Neglect Act. Kerry also co-wrote the books Alzheimer's and the Law Don't Let Dementia Steal Everything, which they are raffling off, so I hope you do put your name in that for that. And he's also a frequent speaker at so many other professional and consumer events. So please give a warm welcome to Kerry Peck.
Recommended by David Hackman.
You're right.
Yeah.
I know, David.
Yes.
Good morning, ladies and gentlemen. Gail, thanks for the kind introduction. Congratulations to Elderwerks on yet another extraordinary expo on senior issues. It's a pleasure to be here this morning, and I'm looking forward to having some fun and providing you with substantial information. We're going to talk today about all the problems that these rich people out in Hollywood had with their estates. And I know we're all going to take out our crying towels and you know, worry about all of their problems. But I'd like it to use that as an example for us to learn from their mistakes. And you know, while we may not have their money, their fame, nor their you know, lifestyle, I think that we can learn quite a bit from seeing that they didn't do things that they were supposed to do. And the average person like you and I can do the things that we're supposed to do and not wreak havoc on our families if we don't do any planning or do planning in an ineffective fashion like these folks here. So as Gail said, I'm Kerry Peck, and I lead the law firm of Peck Ritchie. We have offices in Chicago, Northbrook, Oak Brook, and we both, excuse me, litigate cases. We do a lot of trial work in the courts throughout the Chicago metropolitan area, the probate courts, the chancery courts, and of course we do the estate planning. So we're going to talk about celebrity estate battles. And Marla, please, let's go. Oh, okay. So Gail talked about one of the books that I was asked to write by the American Bar Association is a book called Don't Let Dementia Steal Everything. And the Don't Let Dementia Steal Everything book is going to be raffled off. So Marla, where do you get into the raffle here? At our Okay, so if you'd like to get a copy of this book, which really is, I think, just an extraordinary reference book, it's written in non-legalese. I wrote one book in legalese for lawyers and judges, and another book for families and non-lawyers in non-legalese. And this is the one in non-legalese. And celebrity author Scott Turow, who's now got yet another bestseller out on, they just put out, Suspect, was kind enough to write the foreword to this book. His mother suffered from Alzheimer's disease, and he wrote, Alzheimer's disease is one of the scourges of our time, and one whose toll on the country will only deepen with the aging of baby boomers, the inevitability of increased lifespans. Curing Alzheimer's would probably do more than any single step to reduce healthcare expenses and, far more important, improve the quality of life of the elderly here and around the world. So if you have a loved one, these are issues that are on the forefront of your mind. Take a look at this book. We were able to produce it at just a ridiculously low amount of money. I'm not trying to sell books, but I am trying to tell you this is a resource that just by all accounts, everybody that's ever gotten near it loves it. All right, let's roll. All right, so let's talk about elder abuse. Brooke Astor's grandson, Philip Marshall, says, while elder abuse is a trend, it's not our destiny. Of course, Brooke Astor was abused by her family, and millions and millions of dollars were taken from her. Again, not the problems you and I have, but the problems that we can learn from. 1 in 10 Americans over the age of 60 have experienced elder abuse. And elder abuse comes in a lot of different forms. Kevin from the sheriff's office down in Joliet can tell you the crazy scams that are attempted to be perpetrated today. We call them grandparent scams, calls in the middle of the night. Your grandson allegedly says, Grandma, I need money. Wire me the money in the morning. I'm in jail in Mexico or something crazy. And regrettably, people who are in the middle of the night woken up, do it. My mother's gotten 3 of these phone calls already. So about 5 million seniors are abused. Often they're abused by loving family, okay? Family that wants their money, okay? Follow the money. This is a follow the money scenario. One study estimates only 1 in 24 cases are reported in elder abuse. Elder abuse also comes in the form of caregivers. So we need to be careful who we bring into our home and to provide care for a loved one that might be cognitively impaired or might just have a physical malady. So recent studies also show us that about 50% of the people who have dementia experience some type of abuse or neglect. Gail, when she introduced me, said, when Mayor Daley II was in office, he hired me to rewrite the entire state of Illinois Elder Abuse and Neglect Act. And I went down to Springfield and I testified in the House and I testified in the Senate, and we persuaded the legislature to, at that point, implement mandatory reporting of elder abuse, which kind of changed the landscape entirely. Anybody that has a license other than bankers and lawyers are mandated reporters. A podiatrist, a dentist, mandated reporters of elder abuse. Changes the landscape again. So, and regrettably, seniors who are abused take on an additional load and they die early, okay? They die early. The statistics show us that the death rate is up to about 300% higher than those that are not abused in the elder abuse world. Take a look at the last bullet point. Seniors lose up to $36.5 billion with a B, $billion each year to financial abuse. It's just shocking. It's hard to believe. Imagine what we could do with that money or keeping it in the families that need it. So the Illinois Adult Protective Services, the acronym APS, some of you may work with APS. APS is where most people start. Some people dial 911 and call the police if they've been abused. And some people call the Adult Protective Services Department. The APS folks reported an increase of 25%. Certainly during the pandemic, I think there was a lot of elder abuse that nobody ever was reporting. We didn't see each other. We didn't talk to our friends and our family very much. So a lot of elder abuse clearly never made it to the reporting stage. Average age, ladies, is about 70 years old, and it's a woman. 61%, that's a high proportion. 61% of abuse victims are women. Financial exploitation, clearly, again, follow the money, okay? This is all about abusing people for money. Most abusers were family members, again, and I say, quote unquote, loving family members, loving that money. I love grandma, I love mom, I love papa, as long as I can steal their money. And that's the reality. Social workers and counselors reported the most instances of abuse. They account for about 27%. Relatives only account for 10%, and of course, self-reporting is only 8%. Our problem in the older adult abuse area is that older adults don't want to report abuse. Okay? They're afraid that their family is going to say, well, if you can't handle your money and you can't hang up the phone instead of giving people your money, you belong in a nursing home. So as a result, older adults generally don't even tell their families that they've been abused. An extraordinary problem that we're going to talk about. Statistics again, Census Bureau, we've got more than 54 million people now over the age of 65. And that accounts for almost 17% of the population. Those are the highest numbers that we've ever had before. Number by 2050, the total number is projected to be about 20% of the population in the United States over the age of 65. So that means we've got a lot of people that are drawing down their Social Security. They're potentially retired from work. They're relying on perhaps pensions. They're dipping into their savings, their 401ks, and they are ripe for the picking for exploiters in the context of money. All right, so you came to hear about celebrities. Let's talk about some celebrities, some stars, some athletes, and some entrepreneurs that just totally screwed up their life and the life of their families. Jim Morrison. Jim Morrison was the leader of a rock group called The Doors. And Jim Morrison, at the age of 27, died of heart failure. Jim was a maniac, okay? He was into drugs and the high lifestyle as a rock and roll guy. He had an overly simplified 2-page will, okay? He was at the top of his game, ladies and gentlemen. He was making money hand over fist. He was making more money than he could even count, okay? What happens? His entire estate goes to his girlfriend, or if she dies, to his siblings. Well, his girlfriend dies intestate without a will. So his entire estate is then transferred to the girlfriend's parents. Why? Because it goes without a will from her to her parents. Okay, a little crazy. I know what it says up above. Jim's parents dispute the estate going to the girlfriend's parents. Can you imagine? Okay, not wife, girlfriend's parents. And her parents ultimately agreed to settle the case where Jim's parents got 50% and the girlfriend's parents got 50%. Now, that results insane, okay? I mean, think about it. Had Jim written a will that said, I leave my assets to my family, bingo, that problem's gone. And he didn't do it. And obviously, this is the result. It's a pretty weird result. So, Prince, Purple Rain. Many, many, many people in the room have heard that song. And of course, Prince died from a drug overdose at the age of 57. He died without a will. Nobody, nobody in our scenario here really believes they're ever going to die. Okay, and collectively, most of us do not want to face our own mortality. We're not prepared to put on pen to paper. Some people still think if you sign a will, that means you're ready to die. So, I'm here to tell you that's not the case. So Prince dies at the age of 57 without a will, and tons of people, okay, just tons of people assert that Prince owes them money as creditors of the estate. The court determines that his estate should be divided amongst 6 siblings. One sibling died, and so that estate gets opened without a will and that kind of scenario. So yet another ridiculous outcome in which many, 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 many creditors rush to the forefront. With famous people, it's pretty common that everybody in the country runs in, I'm using that as an acronym, and says, Prince owed me money, okay? I was his best friend. I fixed his car. I painted his house. okay? And nobody in Prince's entourage has any record of who did anything. So everybody's just kind of like, Judge, pay me out of the estate. And of course, at the age of 57, doing drugs, printing money basically for a living with extraordinary success. All he had to do was, take some time out or have one of his advisors say, hey, it's time to do estate planning, okay? It's time to provide for your family in a reasonable way. Philip Seymour Hoffman, Academy Award winning actor. He dies at the age of dies with $35 million, okay? $35 million. He leaves behind his longtime companion and 3 children. His will was executed in 2004 when he only had 1 child, okay? A real common problem. People do wills and they have more kids. They get married a second time. They have kids with another wife or another husband. So his outdated will did not provide for his 2 younger children. What do you think those kids did? Well, if I'm their lawyer, they sue like crazy, okay? Because the reality is he's the father, but he hasn't provided for them under the terms of a will. And, not an uncommon problem with average, quote unquote, people like you and I. Next slide, Marla. So Michael Creighton made his money in Jurassic Park and the TV series ER. And Michael Creighton left behind, almost similar to Hoffman, same kind of problem. He leaves behind a messy estate because his son is not born yet, okay? His son is being carried by the mother of the child when Creighton dies of cancer, but he doesn't provide for it. And in fact, look at the provision in his will. He says, I have intentionally made no provision in this will for any of my heirs or relatives who are not mentioned or designated, and I hereby generally, specifically disinherit every person claiming to be or who may be determined to be my heir, except as mentioned in the will. So imagine, okay? That's a real big problem. He's pregnant with another gal. He's about to have a child, and he specifically disinherits that child, knowing that he's dying of cancer. Shouldn't he have sat down with a lawyer and said, I'm dying of cancer. My life circumstances have changed. When your life circumstances change, you need to change your estate plan. When you have another grandchild that you'd like to add, when you have somebody that's in your documents that unfortunately dies, you need to change those documents. Documents are changeable, amendable, revocable, okay? They need to move through life as your circumstances change. Next slide. Aretha Franklin, the Queen of Soul, songwriter, activist. She dies from pancreatic cancer in 2018. She's only got $17 million, okay? Her estate is supposed to be split between 4 sons and a cousin until 2 handwritten wills are found in her home. The family feuds over what those handwritten wills say. And they do battle in court for years and years and years. Now, Kerry, question, handwritten wills valid? Well, the answer is sometimes, okay? I've been a lawyer now for over 40 years, and I've never seen a handwritten will that didn't have trouble or problems. So people that say, well, I can save some money, I don't have to go see Kerry, I don't have to go see a lawyer, I can download it from the internet, and I can write my own will. Okay, you can, but you don't know the problems you're leaving your family behind because you're 6 feet under. It's just that simple. Questions along the way. Anybody have questions along the way? We don't have to hold them till the end. I'd like to do this interactively. Yes, sir.
Just real quick, I have an ex-wife with 2 kids. I have a current wife of 25 years with her, but does the language kind of grow with you? I mean, can you do children born of the marriage? So future kids brought on later kind of automatically included in that language?
No, the language does not grow with you unless it says, you know, my children specifically. I think that if you have multiple marriages, your documents should say, I had John and Mary with my ex-wife Joan, and I have Sam and Paul with my current wife Mary. Okay? And I wish to provide for them all. Or I don't wish to provide from them all. In Illinois, we can disinherit anybody we want except our spouse. Okay? We can disinherit children. And people do disinherit children, you know? And most common reason is, you know, I don't get along with them, I don't like the guy they married, or the ridiculous one, which unfortunately we hear on a regular basis, is I didn't get a Christmas card this year. Okay? And you can laugh, but I'm telling you, I hear it. Any other questions before? Yes, ma'am. Mm-hmm. Flip back, Marlon. Yeah, for the children.
My question is on that suit. Who would you be suing? Would you be suing a lawyer for legal malpractice for not anticipating, after-born children? Or?
No, I would be suing the estate to get my two children as clients their share of dad's money. So fundamentally, let's go back and make it clear. He doesn't have the two kids provided in the document. Okay? The answer is, if those kids are my clients, I'm going to sue the estate, basically to construe the will so that my two clients who are not included in the will get a share of dad's estate.
Well, of course, you're a lawyer, so, I'm thinking about legal malpractice, but wouldn't the lawyer have been writing up the will if it's sloppily or something that he didn't?
Well, okay, so if you're looking to sue the lawyer for malpractice, you could do that provided he went to the lawyer and said, I had two more kids, and the lawyer failed to put them in. Okay? More commonly is, and I don't know what happens specifically, but more commonly is people have children, people change spouses, and never tell the lawyer. So the lawyer can't be held accountable unless he or she has the knowledge. You know, if Hoffman comes in and says, hey, Kerry, I now have 3 children, and I write a will that says they only have 1, then I've obviously done it wrong. Okay? But it's not going to happen in my office. Gail.
So let's say after, Seymour passed away, and for some reason, some woman comes up and says, you know what, your father died. What happens when people come up, say, my father is some celebrity, and they're not, of course, not named in any of the estate?
Well, what happens in most instances is DNA testing done. And often, if Seymour is 6 feet under already, he's going to be exhumed to take a sample of his DNA and see if it matches the kids. Because in these celebrity cases, a lot of people usually pop up and go, hey, my mom had a one-night stand with Seymour, and, I'm part of the result. Right. When there's money like this, people do and say anything. Yes.
If you had a will and your spouse passes, and the lawyer no longer is practicing, retired, you start over, or do you?
You start over.
Okay.
Start over. Get a new lawyer. That lawyer could write perhaps a codicil, which is an amendment to a will, a fancy term, or write a new will. But generally, if you lose a spouse, you should write a new will. Yes.
Sounds like some people might be doing this really often. How?
Doing what?
Writing wills.
Oh.
Writing wills.
Okay, I got confused.
But you know what I'm saying? Like,
Yeah.
how is that handled by the attorney and the person who's getting the will written? I mean, is it it all planned out from the get-go when you meet, not having ever done this, so.
I'm not sure I understand the question.
I guess, and then
How do you start?
yeah, like, is it, and do you, like I said, how often are people coming back to you? Because every time they're paying you money, or is that part of a?
No, so, okay, so good question, good question. In general, lawyers charge for their services as provided, okay? In estate planning, yes, I would say that each time you come in, it's gonna be a different fee. How do you get started? In my office, we send you what's called an estate planning questionnaire. You fill out all the questions, you send it in, we meet with you, and we tell you in print and writing what the fees are gonna be, okay? If your circumstances in life change, they're not gonna change more than, I mean, in general, 2, maybe 3 times in your whole life. I mean, unless you're changing spouses faster. But the reality is, you know, I mean, what I'm talking about in terms of changes, again, I'm leaving my entire estate to Jane Doe, and Jane dies, okay? That's a document that needs to be changed, okay? I have a new grandchild, and I want to provide for that grandchild's college. I think you should amend the document to add that grandchild. Now, some documents can be written that say, I leave $20,000 to each of my grandchildren at the time of my death for their college. And that means you don't have to rewrite or change that document. So there is a way to put some language in documents that, as that gentleman said, grows as time passes. But big changes in life, you get a divorce, somebody dies, you know, those are documents that need to be redone. Otherwise, you're going to leave a mess behind for your family. And you know, we litigate those cases, and they're just not necessary to be litigated. Yes?
You said something about all grandchildren and future grandchildren?
You could. Yeah, I think you can.
Does it have to be specific, or?
Well, you could say the grandchildren, you know, the children of my children, okay? You know, I have 2 children. I have a boy, Tom, and a girl, Sally. Their children at the time of my death that they had with, you know, you may not want to give Sally the chance to change spouses and leave with the same amount of money. So the children that Sally has with David are my grandchildren, you know, future grandchildren. Those children deemed to be my grandchildren at my death shall receive $20,000 for college education. Okay? Clear? Everybody understand?
How often are people, even if they have a will that's pretty well written and all that, how often are people having, like, going to court over a will? How often are people going to court? Like, is it?
I can't really. I mean,
Okay.
we do a lot of trust and estate litigation, okay? And it's usually over issues relating to someone doing wills when they are cognitively impaired, okay? Someone's diagnosed with dementia, and one of the kids takes them to a lawyer who writes a will cutting out all the other children, okay? Those cases are common, and those cases are in court litigated on a regular basis, okay? I've got cases, I have a case now in which the will was signed, we believe, 12 hours before the gentleman died, okay? He was in the hospital. Was he capable? In our opinion and the doctor's opinion, no. So don't forget, when you sign a will, you need to be of sound mind and memory. That's the legal language. Sound mind and memory. Ultimately, that is going to be determined by a physician if the case goes into court. You also need to be not subject to the undue influence of others. So the example I gave you, the daughter who takes dad to the lawyer, or the daughter that takes dad, that goes into the hospital, literally, you know, after visiting hours, and takes dad's hand and writes it across a will, that's the undue influence of somebody else. So you need to be of sound mind and not subject to the undue influence of others. And in order to be mentally, cognitively sound to sign a will or a revocable living trust. I would say the answer is yes. Yeah. All right, where were we? So Sopranos, you know, everybody, probably, how many people in the room watch The Sopranos? Yeah. So The Sopranos was a pretty big popular show. He dies at the ripe old age of 51, obviously never expecting to die. He's got $70 million from his success as an actor. And he doesn't do a planning in the nature of, if you do estate planning, you can avoid or reduce the taxes that are due at your death. For example, in Illinois, we have a death tax, okay? Death tax is assessed if you have assets over $4 million, excuse me, you will pay a death tax of about 30%, roughly. That's pretty huge. Most people go, Kerry, I don't have that money. But the reality is, when you start adding up the increase in values of real estate and potentially your 401k and so forth, you probably are going to get, you know, some point reasonably close. Now, the federal government has a much bigger exemption of $11 million, so it doesn't affect many people. But the reality here is, this guy loses $30 million of his 70 to taxes. Had he gone to a capable estate planner, could have been avoided. Okay? Now, do you think his family wanted to give up $30 million? Crazy, crazy. Tom Petty, lead singer of the Heartbreakers. You've heard his music all the time. He dies also of an overdose. His wife, prior wife, and daughters from a previous marriage fight over the handling of his artistic and intellectual property. Ultimately, the case is settled for $5 million. Multiple marriage scenarios breed litigation, okay? Multiple marriage scenarios. We frequently have the children of the first marriage fighting with the second wife, okay? Because the second wife is persuaded her husband to either cut those kids out or to rapidly and significantly diminish their inheritance. So multiple marriages are just breed disputes. Sonny Bono, you remember Sonny died of a skiing accident. I think he hit a tree. Of course, he was married to Cher at one point, and he had no estate planning at all. His wife, Mary, petitioned to be executor. Cher filed a lawsuit claiming that he didn't pay her from, child support and maintenance from their divorce way back in the 70s. Another man claimed to be Sonny's love child. That's one of those, I had a one-night stand type story. And there were just a lot of disputes, but no planning of any kind. I mean, just crazy. Next slide. Robin Williams, Mork and Mindy, very famous, Mrs. Doubtfire. Poor Robin Williams had, mental illness problems for many, many years, ultimately commits suicide. He also had Lewy body dementia, and he left behind over $100 million. Now, Robin Williams was married 3 times, had 3 kids, names them all as heirs, and his then current wife disputes over how much money she needs to remain in the home, basically their marital home, with his 3rd wife. And then she acts against his wishes by challenging his plan in public. This one's a pretty complicated scenario. So, the real reality show. Let's hit it. More than 50% of Americans think that estate planning is important, or somewhat important, but only 1/3 have a will. And you can see the reasons why. Approximately 1 in 5 people don't know what the term advanced healthcare directive is. And let's flip ahead, Marla. And in Illinois, we have two kinds of, we call advanced directives, or more commonly, powers of attorney. In Illinois, we have a power of attorney for health care and a power of attorney that's called property. Power of attorney, durable powers of attorney for health care and property. Property is not just real estate, it's asset management. Those documents are to be effective when we're not capable of making our own decisions. So I name my wife to manage my health care. I name my wife to manage my assets when I'm not capable of managing them myself. Who's going to decide if I'm capable? My doctor. Okay? The person that knows me medically the best. Let's backtrack for 1 second. So common exploitation schemes, we've talked a little bit about the grandparents, fraudulent deeds, regrettably, drafting new estate plan documents, regrettably, conversion, of course, which is theft of money, and the roofer that knocks on your door and says, I noticed the shingles were loose from the street, don't let them in under any circumstances. Breach of fiduciary relationship. A fiduciary relationship is, in the law, the highest level of relationship one can have. Lawyers are fiduciaries with their client. We talked a little bit about undue influence. Again, someone subject to undue influence to do an estate plan. That estate plan potentially can be overturned. Caregiver exploitation we talked about, and mental capacity. Don't forget, in the courtroom, the mental capacity is going to rely on medical evidence. A judge or a jury is going to decide, but the evidence is going to be medical. Unfortunately, we see some spousal abuse in the elderly. Let's move on. Exploitation potential. Recently widowed individuals, more often not than women, they get lonely. We see a lot of internet love scams, okay? We see them occurring on dating sites. We see them occurring, regrettably, places we thought were safe, synagogues, churches, senior centers. We see a lot of younger women preying on older men. I had a case in which a younger woman literally went to church shortly after this gentleman lost his wife, sat down next to him, and a week later she was living with him. So it's a real big problem. What do we want to do to avoid all these problems? We want to do estate planning. We want to perhaps engage in probate avoidance. What's probate? In Illinois, we have two kinds of probate. A lifetime probate, which is a guardianship. Okay? Is Kerry capable of making his own decisions? If not, who should make his own decision? Who should make decisions for him? It's kind of a two-pronged inquiry. Does he need a guardian? And if so, who should it be? That's a lifetime probate. Most people don't even know it exists. Okay, if you don't have a power of attorney documents and you don't have a revocable living trust, you're likely to end up in a lifetime guardianship case. Most people focus on post-death probate. In Illinois, if you die with assets in your name alone, again, in your name alone, in excess of $100,000, the law requires that a post-death probate proceeding be opened. A probate proceeding is an artificial entity opened in the county court, probate court, where you reside as a resident at the time of your death. So in Cook County, it's a daily center, and every other county has, at the county seat in the courthouse, a post-death probate. Gather the assets, appoint someone to manage the estate, and ultimately report to the court. Judge, can I have permission to sell the marital home? Judge, can I have permission to distribute the assets under the terms of the will, et cetera, et cetera. So estate planning really is a distribution of assets upon death. Gather the assets and distribute under the terms of the document. Advanced planning is in the nature of our power of attorney for property. Healthcare, the same. Avoidance of probate, we want to use a revocable living trust, or we want to have all of our assets in joint tenancy, or all of our assets with a payable on death beneficiary. We don't want to have $100,000 in our name alone in value. Doesn't matter whether it's cash, doesn't matter whether it's a house, doesn't matter whether it's cars. We want that number lower. Or we potentially, again, want to use a revocable living trust. I think, go ahead. So probate, again, court supervised transfer of assets. We're talking about the post-death probate. The law requires that probate estate be open not less than 6 months. Generally, they're open longer. Why? Because the law allows creditors, your credit card companies, your doctors, the funeral bills, your car loans, things like that, allows creditors 6 months to file claims in probate court against your estate. You can see the typical costs involved. And don't forget, it's a public proceeding. If we use a revocable living trust, it's not a public proceeding. It's done in a law firm conference room. Next slide, please. So Elvis had a probate estate, and Elvis died at the young age with $10 million. He had almost $4 million in debt. He spent $2 million in administrative expenses. He had estate taxes of over $3 million, and he left to Priscilla less than $1 million when he started with 10. Okay? Much of these expenses were avoidable, many of these expenses, with good planning and good counsel. So, joint tenancy, excuse me, if I own my house in joint tenancy with my wife, upon my death, she gets it. Joint tenancy is short for joint tenants with right of survivorship. If I own a bank account with my wife at my death, she gets it. Now, what you need to know about your joint tenants, and you need to choose them wisely, is that a joint tenant has 100% invasion rights of the asset. So if you pick a joint tenant and you put them on your bank account, and that joint tenant needs money and goes in and takes the money, they're entitled to do that. The only joint tenancy that requires 2 signatures is a house, a real estate transfer. That requires 2 signatures. So it's a problem. Choose your joint tenants carefully. Revocable living trust, okay? Revocable living trust is a state-of-the-art planning to avoid probate. Why? Because there is a legal fiction that's been adopted in all 50 states. If I take my assets and I put them in a revocable living trust, that asset does not go through probate. It could be well in excess of $100,000. What I need to do, though, is I need to change the title of that asset. So my house, if it goes into the trust, it says, Kerry Peck, trustee of the Kerry Peck Revocable Living Trust, taking title to the house in the trust. Okay? It's private. It can be done again in a law firm conference room. It's amendable, it's changeable, it's revocable. Revocable. I'm saying revocable compared to irrevocable. Somebody wants you to sign an irrevocable trust, don't do it. Unless they've got a really, really good reason. And make sure it's a lawyer. So the revocable living trust avoids the need for that lifetime probate. Why? Because we name ourselves trustee and we name someone else to be our successor trustee when we're not mentally competent to manage our assets. We avoid that lifetime probate with the use of a revocable living trust. Allows for estate tax planning as well. You know, could have been used in half a dozen of the slides we looked at already. So a revocable living trust does not provide asset protection. Some trusts do. And it allows for some creditor protection kind of down the line. But it's an integral part of an estate plan. Many estate plans today are a revocable living trust, power of attorney for healthcare, power of attorney for property, and what we call a pour over will, which literally is what it sounds like. Assets that aren't in the trust pour over into the trust upon death. But they still need to be below 100,000 in value, or you need a probate estate that you're trying to avoid by using the revocable living trust. Powers of attorney, there's kind of the Doublemint twins up there, some of you might remember. We name an agent to make decisions for us when we're not capable of it. Somebody we love, somebody we trust, and in essence, your legal clone. These are power of attorney agency relationships. I'm the principal, not of a school, and Gail's my agent to make decisions when I can't make them. Terry Schiavo was litigated, you might remember, for years and years and years. Political football, bounced its way through Florida, bounced its way, I think it hit the desk of then President Bush. End of life case. Her parents said she smiled and was still alive. Many others said no. Her estranged husband claimed that they had talked about it when they were married. Of course, he had moved on to a new woman, so I think his credibility wasn't so good. But the reality is, end-of-life decision-making can be done with your power of attorney documents. Again, none of us want to face our own mortality, but you will be asked in a power of attorney document, do you want to be an organ donor? Okay. Do you want life support? What kind of life support do you want? Today, we can be kept alive on medical technologically advanced equipment long after the quality of our life is gone. Is that what you want? Yes, no. We all bring to the table our religious beliefs, our ethical beliefs, our moral beliefs. None of them are right, none of them are wrong, okay? The question is, what's best for you? All right, come on up. So we've talked about the power of attorney for property, how it's going to avoid guardianship. It's particularly useful to manage assets that we can't put in joint tenancy, like those listed at the bottom, particularly IRAs, 401ks, etc. Next slide. Power of attorney for property, we can use it to manage assets, sell homes, create a Medicaid trust if we need to. The air conditioning just went on. Oh no, the fan, there you go. Thank you, Bruce. Whoa, what a difference. Go ahead, next. Oh, no power of attorney for property. We talked about it. You're going to have that lifetime guardianship unless you use a revocable living trust. Yes, ma'am.
Can you go back to the previous slide?
That one?
Okay. Holbrook Trust, what is that?
An Ober trust is often used for individuals that want to qualify for Medicaid. Medicaid is a government-provided benefit in which basically you have to have very little assets to qualify for government, either placement in a nursing home or receive some medical care. We all qualify over the age of 65 for Medicare. This is a needs-based, asset-based test. So I think we've talked about these, power of attorney for healthcare, power of attorney for property. The second act of our show, so to speak, don't delay, okay? Just don't delay. These are important issues. They're important to understand that if you don't do it, you leave behind a mess. And as I said earlier, you don't know what that mess is you're leaving behind because you're gone. And we can avoid these messes with planning. In my law firm, we offer individuals the opportunity to meet with us for half an hour at no cost. See if you like us, see if we want to work with you. Today some of those meetings are in Zoom, in person, by telephone. COVID's changed a lot of the manner in which we all conduct our lives. But if you'd like to meet in person, we can arrange that. And, just don't wait, because you don't know tomorrow if you're getting hit by a bus. Kevin.
When a power of attorney for health is made, it's obviously got to be given to the doctor, correct?
It could, a power of attorney for healthcare can be a,
Or what it has to be both.
well, when we do power of attorney documents, the choice is given to the person who's, creating it. That document can become effective immediately or upon your doctor's certification that you can no longer make decisions.
Okay, so like, let's say, for example, it's done by an attorney. The doctor says this person no longer has any mental capacity or ability.
Right.
On that day when that decision is made, will there be something that says that on this day the doctor says, I vote or I see this?
Well, it depends who's handling it. I mean, in my office, we would put the doctor's note or evidence that we spoke directly with the doctor, but generally we'd want it in writing, in the file. So there would be a timeline on it.
Because I was just curious because like who's to stop the other daughter, like another kid or so. Oh, well, this is the real power of attorney, but it's already been fought. Yeah.
It's a great question. We frequently have what I call dueling powers of attorney cases, okay? In which kids run and get one after dad's no longer capable, or they, do it under different circumstances. So it happens. Bruce?
Yeah, we also have one online asking a very similar question. They said they've got an older adult who has vision and hearing problems, and so their communication skills are limited. They've got the support of their children, but how do they deal with that in a way that's appropriate for that person to come to the lawyer and ensure that they're doing the right thing?
I think they're going to have to find a lawyer that can either, help them with sign language or something comparable, or the vision issue is a tough one. I've not seen these documents in Braille, so that's a problem. Yes.
If you move to a different state, you have to change your.
Yeah, when you move to a different state, you should have your documents checked by a local lawyer in the state you're moving to.
State to state, things may be different.
Yes.
Oh, okay.
Yeah. Trust and estate law is very much impacted by state law. Yes.
If an adult has a legal guardian because of developmental disability, has a trust, special needs trust already, they don't need a will, right? Because the legal guardian would be, how does that,
Let's talk afterwards, okay?
Okay.
Yes.
An additional question online. Somebody indicates that they're probably below that $100,000 limit for probate. Should they have a will even at that point?
Well, I think everybody should have a will so that it lays out who's going to manage those assets. If that 100,000 is in joint tenancy, then you might not need a will. If you have a POD, payable on death beneficiary, or it's in joint tenancy, then you may not need a will. Any other questions? Yes, ma'am.
You've got the disposition in a way that's outside of probate. Like, for example, if you have to pay on debt, you have a life insurance policy, you have a 401k with the named beneficiary, anything that's got a named beneficiary. Am I correct assuming that trumps the will if there's a discrepancy between who the beneficiary is and who the will says gets the money?
In a payable on death account versus a will? Yeah, I would say that you're inviting litigation in that case. If you have a will that says I leave it to Kerry and a payable death that says I leave it to Gail, one of us is going to sue. Yes, ma'am.
If you live half of the year in Florida and half the year in Illinois, and your trust is in Illinois, can you have a second trust in Florida?
It's not a good idea. You need to determine whether you're going to be a Florida resident or an Illinois resident. And it's, 6 months plus 1 day. And that will really kind of determine where your residency is.
Thank you.
Sure.
Doesn't the driver's license determine state of residence or no?
Well, it can, but you can only, for example, have one driver's license. So,
If you have a driver's license in Florida, but your estate planning in Illinois,
the problem.
it's
It's a problem. You got to decide where you're going to live. And of course, in Florida, people move to Florida today to save tax money. There's no state income tax in Florida. And there's no death tax. We talked about inheritance tax, death tax in Illinois. There's no death tax in Florida. So people are flocking to Florida. I'm licensed in Florida. People are flocking to Florida to avoid taxes and get good weather. All right, folks, thanks so much for coming out. Have a wonderful day. Thanks again to Elderwerks. I don't know. Marla, do you know who this gentleman gives us?
That works. Do you have a card on you?
Yes, ma'am.